This podcast is for educational purposes only. It is not medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making decisions about supplements, peptides, or medical therapies. Glutathione is often called the body's master antioxidant. It is a small peptide made up of 3 amino acids: glutamine, cysteine, and glycine. What makes glutathione special is its ability to protect cells from oxidative stress and free radical damage. In simple terms, it helps keep your cells young, functional, and resilient. When levels of glutathione drop, the body becomes more vulnerable to disease, inflammation, and aging. Today we are going to spend time exploring glutathione in depth. We will look at what it is, how it works, the science behind it, and how people use glutathione as a peptide therapy to support health, longevity, and recovery. Glutathione is produced naturally in the liver, but also in every cell of the body. It plays a key role in detoxification, immune support, and energy metabolism. Imagine glutathione as the body's cleanup crew, always ready to neutralize toxins, heavy metals, pollutants, and even byproducts from normal metabolism. Without enough glutathione, toxins can accumulate, oxidative damage increases, and cellular repair slows down. That's why researchers have linked low glutathione to conditions like chronic fatigue, autoimmune disorders, neurodegeneration, and premature aging. One of the fascinating aspects of glutathione is that it works as both an antioxidant and a detoxifier. As an antioxidant, it donates electrons to unstable free radicals, stabilizing them and preventing damage to DNA, proteins, and lipids. As a detoxifier, it binds to harmful substances so they can be safely eliminated through urine or bile. This dual action makes glutathione one of the most important protectors of long-term health. Now, let's explore how glutathione connects to aging. Studies show that glutathione levels decline as we get older. In young people, glutathione is abundant, but with age, chronic stress, environmental toxins, and poor diet, levels drop significantly. Low glutathione means higher oxidative stress, which accelerates cellular aging. It's like rust building up in your body. Researchers believe that maintaining healthy glutathione levels may slow down the aging process, improve energy, and support healthier skin, brain, and immune system function. Athletes are particularly interested in glutathione peptides because of their impact on recovery. Intense exercise creates oxidative stress, which can damage muscles and delay recovery. Supplementing with glutathione, or using peptides that support its production, may reduce muscle fatigue, shorten recovery times, and improve endurance. In fact, several clinical trials have shown that glutathione supplementation helps reduce lactic acid buildup and supports quicker rebound from strenuous workouts. Another area where glutathione peptides shine is in liver health. The liver is the body's detox powerhouse, and glutathione is its primary weapon. Whether from alcohol, medications, or environmental exposure, the liver is constantly processing harmful compounds. Glutathione protects liver cells, supports regeneration, and helps prevent long-term damage. This is why glutathione injections are sometimes used in medical settings to treat liver disease, alcohol damage, and even chemotherapy side effects. Let's talk about delivery methods. One challenge with glutathione is absorption. Taking glutathione orally in capsule form has limited effectiveness because it is broken down in the digestive tract. To overcome this, different methods are used. One is intravenous glutathione, which delivers it directly into the bloodstream. Another is liposomal glutathione, which uses fat-based delivery to improve absorption. Then there are peptide injections and precursors such as N-acetylcysteine, also known as NAC, which help the body produce more glutathione naturally. Each method has pros and cons, but injections and liposomal delivery are generally considered the most effective. Some people also use glutathione for skin health and aesthetics. It has gained popularity as a skin brightening treatment because it can reduce oxidative stress and influence melanin production. While some consider this a cosmetic benefit, the deeper truth is that glutathione supports the skin by protecting collagen, reducing wrinkles, and improving overall tone and elasticity. Now, let's go a little deeper into the science of glutathione peptides. Researchers have studied its role in protecting mitochondria, the powerhouses of our cells. Mitochondria produce energy, but they also generate free radicals as a byproduct. Glutathione is the first line of defense inside the mitochondria, ensuring that energy production continues without damaging the cell. Without enough glutathione, mitochondrial function declines, which can lead to fatigue, neurodegeneration, and even chronic disease. Protecting mitochondria is one of the key reasons people turn to glutathione therapy. Another fascinating area of research is glutathione's role in brain health. The brain is particularly sensitive to oxidative stress. Low levels of glutathione have been linked to conditions like Alzheimer's, Parkinson's, and multiple sclerosis. Some studies show that restoring glutathione levels improves memory, reduces neuroinflammation, and protects neurons from degeneration. For people focused on longevity and cognitive health, this makes glutathione peptides a compelling tool. Let's shift to immune function. Glutathione doesn't just protect cells, it also regulates immune response. It helps immune cells fight infections while preventing overreaction that can cause autoimmune flare-ups. People with chronic illness often show depleted glutathione levels, and restoring balance can improve their resilience. During infections, glutathione plays a role in controlling inflammation and reducing the severity of symptoms. This is one reason glutathione has been studied in viral illnesses and respiratory conditions. We should also talk about how lifestyle impacts glutathione levels. Smoking, alcohol, pollution, poor diet, and chronic stress all deplete glutathione. On the other hand, exercise, sleep, and nutrient-rich diets can support healthy levels. Certain foods, like cruciferous vegetables, sulfur-rich foods like garlic and onions, and whey protein, can all support glutathione production naturally. Supplementing with NAC, alpha-lipoic acid, or selenium can also provide precursors needed for glutathione synthesis. In clinical practice, doctors may use glutathione injections for patients with chronic fatigue, fibromyalgia, autoimmune disorders, or even chemotherapy side effects. While research is still ongoing, anecdotal reports from patients describe improvements in energy, mental clarity, skin health, and overall resilience. There is also interest in using glutathione peptides for detox protocols. Whether recovering from heavy metal exposure, mold toxicity, or medication side effects, glutathione has been used as part of a detox strategy. The key is that glutathione binds to harmful substances, allowing the body to eliminate them more efficiently. When it comes to dosing, there is no one-size-fits-all. Some clinics administer glutathione intravenously once or twice per week. Others use intramuscular injections in smaller, regular doses. Liposomal supplements can be taken daily, while NAC is often used as an oral precursor. The right dose depends on the individual's health status, goals, and tolerance. It's worth mentioning that glutathione is generally well tolerated. Side effects are rare, but can include mild digestive upset or skin reactions. Injections should always be done under professional supervision to ensure safety and proper dosing. Looking ahead, researchers are studying glutathione not just as a supplement, but as a therapeutic agent in serious diseases. Trials are exploring its role in cancer therapy, HIV, neurodegenerative disease, and even cardiovascular health. While results are still preliminary, the potential is exciting. Glutathione represents a unique intersection of detoxification, antioxidant defense, and immune regulation. It is not just another supplement, but a cornerstone of cellular health. Whether someone is focused on performance, longevity, aesthetics, or recovery, glutathione peptides are emerging as a powerful option worth considering. This podcast is for educational purposes only. It is not medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making decisions about supplements, peptides, or medical therapies. Thanks for listening. Keep learning and stay curious.